So one of the main questions I get from patients and from friends and neighbors and even sometimes dentists is, what's the best time for a kid to see an orthodontist? And the American Association of Orthodontics recommends age 7. I also recommend age 7A because that's when the front 8 teeth are in the mouth, when the 6-year molars are in. That's when we can pick up if there's a crossbite, if there's missing teeth, if there's severe crowding, if there's jaw issues, when they have the underbite or overbite. And sometimes it's better to treat those at a younger age before they get teenagers or stop growing as an adult. But most of the time, I would say 70-80% of the time, most patients and most kids don't need to be treated at that age. And we have a very robust observation program that we'll put them in. We don't charge anything. It just allows me to continue to track them every 6 months to a year to make sure that we get them started at the right time. And that's one of the reasons I think we get a lot of referrals from pediatric dentists, a lot of referrals from general dentists, because they know that when you come in at 7 or 8 and they come and see me, I will always look and say, if this was my kid, how would I treat him? Would I put him in braces? Would I do some like Invisalign first option? Or would I keep watching him and wait for more teeth to develop? If the kid's getting teased or if there's social issues, we can do some little cosmetic corrections that usually take 6 to 8 months. But usually that's not the issue in 3rd grade. It usually becomes more of an issue in middle school. But we do like to see the kids around 7 or 8. And most of the time, if they're not ready for treatment, we just put them in observation and see them back every 6 to 12 months. So when you come in for your complimentary exam, we don't just look at how we can straighten your teeth. That's actually probably a minor part of what we look at. We also look at how the jaws fit together. We look at there's habits going on. If it's a kid that has a thumb habit, if you're grinding your teeth, if there's a crossbite. We also look at how your teeth fit with your jaws and your mouth and your lips and how everything comes together with your bite. So straightening teeth is part of it. Obviously, getting the front teeth straight and getting all your teeth straight is important for hygiene, is important for cosmetic and confidence, but that's not the main thing I always look at. I want to make sure that also your bite is fitting well for longevity and comfort, and also to make sure that your teeth and your jaws and everything line up the way they should. And we cover all that when you come in for your complimentary exam at Sims Orthotics. So I wanted to talk about a couple times where we catch things early on a child, and it makes my job easier and it makes the process for orthodontics easier on the child and the parent. One of them is crossbite. So if we can catch a crossbite early, 7, 8, 9 years old, a lot of times we can treat it with an expander. Super easy for the kids. They adapt to it really well. It usually stays in for about 6 months. There's no discomfort really or any type of pain. They sometimes might feel a little bit of pressure, but by correcting that crossbite, which is a skeletal correction, that's for the rest of their life. We correct it, and usually it doesn't need any type of retainers. And the key is that once they get about 16 years old or older, the palate fuses, and it makes it much more difficult to correct it without more invasive procedures. So if we can get that crossbite corrected early, it makes everything easier. Another one is a thumb habit. So if a kid comes in sucking their thumb and they've got an open bite where their teeth aren't coming together, or they've got also a crossbite, if we can get that habit stopped before age 9, a lot of times that'll resolve itself and the bite will close back down. It makes things much easier. So we either stop it by trying to paint something on their thumb that tastes awful, or we can put a little habit reminder in that physically doesn't allow them to get that suction, which is the pleasurable part of comforting part that they get. So those are two things that if we catch it early, it makes everything easier down the road. So I'm not the type of orthodontist that puts braces on every kid that comes into the office. I always want to make sure that if this was my child, how would I treat them? So majority of patients that come in, we see a lot of young kids, 7, 8, 9 years old, and they don't need anything. They don't have a crossbite. They don't have any missing teeth. They don't need any treatment at that point. And so what we do is we put them in our observation program. We have a lot of patients in our observation program that we see every 6 months to 12 months. We don't charge anything for it because I want to make sure they come back. We take photos. Sometimes we take x-rays just to measure their growth and development and see if there's anything that needs to be taken care of, and we can do it at the right time. But that observation program has been amazing because it takes the pressure off the dentist to make sure they don't miss anything. And also it gives the parents peace of mind to know that they're not delaying anything that needs to be taken care of. And that's just one of the big things I think that our practice does that really helps with just the efficiency and the process and the care that our patients get. One thing neat about our practice is that we don't take the mushy molds anymore. We have an iTero scan, and we take 3D scans of the teeth. It's basically like a little 3D camera that goes around. It takes about 2 minutes. Super easy, super fun. The kids love it. The parents love it because when we scan them, it shows up in real time a digital model of their teeth, and we can show them where the bite issues are, where the crowding issues are, and they don't have to deal with the mushy molds, the gagging, and everything. It's actually a lot more accurate too, and it just is one of the one of the many things that we do that just helps with the comfort and the process and the efficiency and just being really detailed orientated. And it's a great thing. The iTero scan with our office, no more mushy molds, Sims Orthodontics, and kids and adults both love it. So if a parent's wondering if their child needs braces or needs to see an orthodontist, what would be the next step? Basically, call our office. You can go on our website, get our number, call our office. Super easy. We have 3 locations, Pensacola, Crestview, and Gulf Breeze. And when you come in, takes about an hour. We take some records of your teeth, x-rays, and photos, and digital scans. I'll come in personally and take a look at everything, go over if there's anything that's needed that I see, or that if we can just put him in observation and watch him grow and develop and lose more teeth. But you don't need a referral, and you don't need any other option other than to call our office.